Risk factors. So 55-year-old female started on new medication regimen, now has hypothyroidism. What's the diagnosis and risk factor? So some new now has hypothyroidism. I don't know, the lithium. I'm not sure about this one. Oh, so it's gonna be drug, yeah, lithium, amiodarone, or high yield causes. So we didn't mention amiodarone, so that's gonna be important, and that's gonna be over here. Let's continue. 55-year-old female started on new medication regimen, now has mouth ulcers. Diagnosis and risk factor. So I'm thinking about febrile neutropenia, which can be due to many drugs such as clozapine, carbamazepine, chlorpheniramine, or like all of those NSAIDs, methimazole, propylthiouracil, all those nonsense. And risk factors are drugs. All right, 44-year-old male, ataxia, confusions, ophthalmopathy, confabulation, risk factors for disease. Yeah, so it's thiamine deficiency, so it's a Wernicke. So diagnosis Wernicke, and thiamine is going to be risk factor. 68-year-old 60-year-old male with gastrectomy from 6 months ago, now has neuropathy. Diagnosis I think is pernicious anemia, and risk factor is surgery. Okay, 60-year-old male with gastrectomy, 6 months ago, now has neuropathy confusion, so that's going to be the same thing but just B1. 20-year-old female MCB, high MCB, hypersegmented neutrophils on smear. What's the diagnosis? 20-year-old high MCB. Okay, so that's me vitamin B12 deficiency, and risk factor is vegan. Okay, 40-year-old female moving the red lung, so the diagnosis is going to be syndrome, and the risk factor is going to be deficiency iron. Okay, 44-year-old male, fever, diffuse abdominal pain with fluid waves. The diagnosis is going to be your the diagnosis is going to be, I guess, cirrhosis, and risk factor is going to be alcohol. Oh, I got this one wrong. Okay, so 44-year-old male with diffuse abdominal pain, and risk factor that's going to be spontaneous bacteritis, and a risk factor are cirrhosis, recent peritoneal, and nephrotic syndrome. Okay, that's important. Okay, 30-year-old female, 36-year-old female, new onset shortness of breath. So new onset shortness of breath, tachycardia. Patient has 5-year history of smoking. Recently prescribed oral contraceptive. A question asked, which of the following would have prevented the patient's acute presentation? So 36-year new onset shortness of tachycardia, has 5 years of smoking. Oh, she has thrombosis, yeah. And OCP would have stopped it. Pulmonary embolism, so combined, okay. Okay, 55-year perimenopausal family osteoporosis, vasomotor wants to know which of the following, okay, makes it's going to be vasomotor symptoms. A 55-year-old female perimenopausal sweat, severe hot flushes, was started on a hormone replacement therapy a few months ago, stopped taking progesterone hormone because it affects mood. So what will most likely be seen over here? Thrombosis, we can see over here, liver disease, hypertension, so, oh, endometrial hyperplasia, okay. Of course, that's important. I didn't think of that, so that one's wrong. Okay, good. A 55-year-old female with a hormone replacement therapy 3 months ago and now has a new breast mass prior to this. What's the next best step? Just remove breast incision, biopsy, whatever. Yeah. To your female for 30, BMI 30, irregular menses, you want to have what is going to be the risk factor? Her obesity. Yeah. And ovulation, which is due to obesity. Okay, so 65-year-old female started on tamoxifen as a part of her chronic breast chemotherapy regimen. Which of the best makes her a candidate for this treatment? She probably had a past hysterectomy. Yeah. Okay, 60-year-old female concerned with ovarian cancer because her great aunt was diagnosed. There is no family history of BRCA. Question: what's the best next step in management for this patient? Just her grandmother had it. Chill, nothing. Oral contraceptives. Okay, oral contraceptives. Yeah, oral contraceptives, tubal ligation, breastfeeding, and pregnancy can help ovarian cancer. 20-year-old female pregnancy, 35-year-old week cocaine use. A painful contraction of abdomen, and the vaginal bleeding diagnosis and risk factors. Okay, 28-year-old 28-year-old female pregnancy. Okay, so diagnosis is going to be not Purkinje, Increta. It's going to be placenta, Urquhart, Increta. It's going to be placenta preeclampsia, and the risk factor is due to your cocaine. Did I say eclamp? I said eclampsia, so that's wrong. Abruptio placenta, yeah. So, okay. Then we can see 28-year-old female. So I got that one wrong. Messed that one up. Okay. 28-year-old female, 35 painless gender. Okay, that's placenta previa. Risk factor, no idea risk factor. What is this? Risk factor is previous C-section. Okay, that's That's important. That's important. I need to write that down. Okay. Let's come at 28-year-old female with postpartum hemorrhage. Placenta is attached to the myometrium. Diagnosis plus risk factor. Diagnosis plus risk factor is going to be 20-year-old female placenta. Okay, so diagnosis is going to be placenta percata and risk factor C-section, multi-priority. Creta, previous C-section. Okay, cool. A 34-year-old female giving birth, a fetal anterior shoulder caught behind pubis. Diagnosis is going to be shoulder dystocia. Risk factor is macrosomia. 34-year-old female has excessive vaginal bleeding despite McRoberts maneuver 2 in setting of the shoulder dystocia. Diagnosis plus risk factors, so that's going to be rupture, and diagnosis is due to shoulder risk factors is shoulder dystocia. So vaginal laceration due to macrosomia. Okay, 32-year-old female with history of amenorrhea, had dilation and curettage, and performed a curettage performed to remove miscarriage last year. Diagnosis plus risk factors, so she had 1 year history of amenorrhea. Okay, cool. She had dilation and curettage performed to remove her last miscarriage. Okay, so it's diagnosed Asherman syndrome, and risk factors may DNC. Okay, 30-year-old female gestation is a cosmetic tenderness. Okay, so here pregnancy is risk factor, diagnosis pyelonephritis. Okay, 30-year-old female epigastric pain after me. So this is going to be diagnosed cholelithiasis, and the risk factor being your progesterone. All right, and also because estrogen upregulates HMG-CoA reductase, that makes more amount of cholesterol. All right, guys, I'm gonna end it over here.